We know you're committed to patient safety during critical care. At Masimo, so are we. For clinicians who want to continuously monitor the oxygenation status of their patients' organs, O3 makes it simple, providing real-time data to make effective care decisions. O3 Regional Oximetry provides cerebral and somatic tissue oxygenation monitoring solutions for all patient populations, including adult, pediatric, and neonates. In certain instances, pulse oximetry may not be fully indicative of end organ oxygen saturation, but with O3, clinicians gain a better understanding of the changes in oxygenation of critical organs that can fluctuate with supply and consumption of oxygen. This may help provide better insight into regional or local oxygen desaturations that can be a signal of the presence of a perfusion problem. This is particularly critical when it comes to monitoring the most important organ in the body, the brain. O3 uses 4 wavelengths of light to monitor cerebral oxygen saturation, RSO2, with absolute accuracy specifications of 4% and trend accuracy of 3% in adults, 5% absolute accuracy and 3% trend accuracy in pediatric patients, and 3% trend accuracy in neonatal patients. The absolute accuracy has been validated using an invasive blood reference method that samples the blood at the brain from the jugular venous bulb. This helps provide clinicians confidence that the displayed O3 values are closely correlated with the cerebral tissue oxygenation status. O3 can be used with the Root platform to provide high-resolution display of O3 monitoring parameters with built-in connectivity. This allows O3 monitoring data to seamlessly flow to the Masimo Hospital Automation platform, along with third-party device integration. See up to 4 O3 windows, with 2 windows for the left and right sides of the brain and 2 for somatic locations. The well-thought-out layout allows clinicians to prominently see and track tissue oxygenation saturation values, RSO2, and trends, along with integrated features like baseline values, trend lines, ΔsPO2, the area under the curve, AUC, and the delta base. The delta base calculates the difference between the current RSO2 value and the user-defined baseline. The area under the curve, AUC, quantifies the depth and duration of the patient's stay under the user-defined RSO2 low-limit alarm. ΔsPO2 calculates the difference between the patient's arterial oxygen saturation, captured with an SpO2 sensor, and the O3 RSO2 value. In the left and right root forehead windows, O3 supports 3 additional parameters to provide insights to potential underlying reasons for RSO2 measurements changes: ΔO2Hb, ΔhHb, and ΔcHb. These measurements allow clinicians to see relative changes in the components of cerebral hemoglobin oxygen saturation. ΔO2Hb and ΔhHb show the relative changes in oxygenated and deoxygenated hemoglobin, respectively, while ΔcHb displays the sum of ΔO2Hb and ΔhHb. In a case series published in 2022 in collaboration with the Montreal Heart Institute, researchers concluded that the ΔO2Hb has been found to change with the arterial component of cerebral blood volume, potentially due to changes in cerebral blood flow, the percentage of oxygen being administered, FiO2, or arterial oxygen saturation, SaO2, while ΔhHb has been found to change with the venous component of the blood volume, potentially due to hypoxia, venous obstruction, or congestion, among other factors. The combination, or ΔcHb, has been found to help clinicians further see changes in cerebral blood flow. These measurements, along with RSO2, provide clinicians better data to understand changes in cerebral metabolic rate of oxygen and have been found to provide a better signal of and reasons behind a desaturation event. It is important to keep in mind that the 3 delta parameters provide relative changes to a user-defined baseline. The importance of safety of your patients is something that is critical to you and to us. This is why we designed the O3 to provide rich, comprehensive oxygenation data so that you can better understand and make the right decisions for your patients. We combined this best-in-class solution with the Masimo Root platform to provide a complete solution to monitor your patient's brain with O3 cerebral oximetry and SedLine brain function monitoring simultaneously. For more information on O3, visit our website or contact your local Masimo representative.